I'm Jonah Comstock, Editor-in-Chief at pharmaphorum. I'm here on day 3 of ASCO 2026, and I'm joined by Tony Jarkowski, the head of immune-oncology at Astellas Pharma. And we're going to talk a little bit about T Cell engagers and ADCs.
Yes, nice to meet you, Jonah. Thanks for having me here.
Yeah, thanks for joining me, Tony. So tell me about what Astellas is bringing to ASCO this year and some of the studies that you're the most excited about.
You know, we're really excited about where we're headed with immuno-oncology. I think immuno-oncology in the past the past 10 years has been really focused on checkpoints and very specific tumor types. But there's still a high unmet need for those patients. Many still relapse, many don't respond at all, and there's a number of tumor types that are not responsive historically to immunotherapy. So we're really focusing on improving the response rate, moving past checkpoints, and thinking about where we head to improve both the response rate and the durability and hopefully overall survival for those difficult to treat tumors with the next wave of immunotherapy that we're thinking about.
So tell me a little bit about, in particular, some of the data that's being presented this weekend.
You know, I think this weekend we have some data focused on our late stage portfolio with bladder cancer and really where we're at with enfortumab and, sticking to that in terms of bladder cancer and fortifying, what enfortumab can do for bladder cancer patients across the disease spectrum overall.
So talk to me a little bit about these two kind of specialties of yours, ADCs and T Cell engagers, and how are those sort of like different modalities? What are their strengths and weaknesses versus each other, and how do you think about that kind of thing?
Sure, makes sense. Yeah, we're very focused on moving forward and have quite a legacy in what we're doing in T Cell engagers and ADCs. Maybe I'll start with ADCs since that really builds upon the data that we've been generating with enfortumab in bladder cancer. We have a legacy there. From an ADC perspective, we're moving forward with a couple different approaches from ADCs. We have been licensed and working with our partner Evopoint on our next generation ADC against Claudin 18.2 as part of our Claudin franchise. And we're also working with our partner Sutro to move what we call iADCs into the clinic. And this takes an immune component with typically what you see from a payload of typical ADCs, and it puts them together. And we're hopeful that that's going to improve the response rate and deepen the response rate and also improve the durability overall in ADCs. From a T Cell engager perspective, this is a newer area for us, but one that we feel like we have a great place to play in. T Cell engagers have been historically and recently showing very good efficacy in hematologic malignancies. And for us, we just put our Claudin 18.2 T Cell engager for GI malignancies forward into late phase. We have proof of concept there. And we did a deal with Vir Biotechnology in this past winter to really partner with them in a strategic collaboration to move forward with their dual-masked T Cell engager against PSMA for prostate cancer, which we think has the potential to really be a best-in-class asset in prostate cancer. And then for T Cell engagers, we have a number of other things moving forward as well. So we're really excited about both those areas.
Prostate cancer seems to be the big topic this year. A lot of data, a lot of different mechanisms of action modalities. So talk to me about sort of the pitch for T Cell engagers as opposed to other, ADCs, radiotherapies, yep. all these different.
Historically at Astellas, we've had a place in prostate cancer. Enzalutamide has been a treatment that we treated millions of patients for and has been a standard of care across prostate cancer. We want to continue that legacy, and we think the data that's been shown with Vir previously for the asset really has a best-in-class potential. If you followed the field for PSMA T Cell engagers, there's many failures in the past, and the data that we're putting forward from an efficacy perspective, both in terms of PSA 50, PSA 90, and response rate, and the manageable safety profile that we're seeing with the asset makes us think that we have a best-in-class potential, where it was previously thought that prostate cancer immunotherapy wasn't going to work in prostate cancer. So we think it has huge potential to be something different than some of the other modalities that are there.
You mentioned iADCs. You said ADCs with an immunocomponent, but of course an antibody is sort of an immunocomponent. So what do you mean?
Yeah, no, it's a great question. We actually put a STING agonist, and STING's not new to immunotherapy, but we're putting a STING agonist and partnering that with a typical ADC payload. And hopefully that will actually improve the response rate and what's happening. Because we think ADCs actually are immune by nature. There's immunogenic cell death. We think STING can kind of come in and hopefully make that immune component more strong overall.
Cool. So, then taking a step back from Astellas, and what have you been seeing and hearing so far at the conference that's been interesting to you? What are some trends that are jumping out to you at this point?
You know, I think to see progress in tumor types that are historically had poor overall outcomes. I think it's impressive to see the outcomes we've seen for pancreatic cancer. It's an area that's really important to Astellas as well. We know the unmet need for patients, and we're continuing to progress a number of our portfolio agents against pancreatic cancer as well. We have our Claudin 18.2 ADC that we're pushing forward ahead there, and then we have an ongoing phase 3 that just started for our KRAS G12G, setagrasib overall. So that's in phase 3 with chemotherapy in first line, and we're really excited about the potential there.
Great. Well, thank you so much for chatting with you, Tony. That sounds like a lot of exciting stuff going on at Astellas.
Yeah, we're really excited about the future in oncology at Astellas.